Stability of the political leadership at the grassroots level is very, very critical. What can government do to ensure political stability at the grassroots, which actually represent the implementation level? Thank you.
Hi, I'm Heather Murdoch from Voice of America, and I was wondering if you have an overall budget for the 1 Million Lives program, and also how much of that funding has already been pledged. Also, you mentioned earlier Begega, and I'm wondering if there's a date for the remediation that you're aware of.
Sorry?
Earlier today you mentioned Begega, the lead poisoning.
Yes.
And I'm wondering if there is a date for the remediation to begin.
Okay. Since we've covered the Secretary General to respond on the first question.
Parliament for two reasons. This global health work that the government is doing is enjoying very broad support in Parliament. And in addition, the present government is a majority government, so we are going ahead with planning, and but at the same time, of course, respectfully following the budgetary procedures. Thank you.
Okay. So, the reality of governance at the grassroots level. You see, this is a public-private coalition. It's a movement. And inherently, that if we truly mean what we say, the local governments, the states that are buying into this, the civil society will keep each and every local government chairman focused on doing what is needed. If a mother dies anywhere in Nigeria, we should ask the question, could this death have been prevented? And who would have been responsible for it? We shouldn't just accept it, because there are things that could have been done to prevent those deaths. That citizen holding all of us accountable. Private sector also needs to play its part. Civil society needs to play its part. I have to say that majority of local government chairmen actually have been stable and are participating and contributing meaningfully. Some are not. And we hope that they will learn the lesson from where there is good leadership at the local level and do what is needed to deliver the dividends of democracy to our people. The representative from, and then the grassroots, the Nigeria Interfaith Action Association led by Bishop Onwoha, the Traditional Leaders Committee, and His Eminence the Sultan and the President of CAN co-chair the NIFA board. The religious community and the traditional community has a network all over Nigeria. Now they're involved in this, and I think they're also concerned about the fact that we're losing women and children. So we need to keep them focused, and they need to keep us focused as well to ensure that we deliver on what we're trying to do. It's not going to happen overnight, obviously, but we're beginning in a course for change that will deliver results that will touch the lives of people. The issue of overall budget for this, the Norwegian, His Excellency, the Norwegian Prime Minister, represented by the Secretary General, said that they had committed $25 million and that money has to be appropriated by Parliament. Now, in the context of Nigeria, we're in the middle of our appropriation for 2013. Already, there is a proposal that is out there which, once appropriated, then will make those public resources available. What Mr. President has said, the polio contribution, the routine immunization is an unprecedented contribution. The subsidiary investment program is also a major part of that. And what federal government is putting in terms of malaria program, HIV program, is all adding to existing resources that government is channeling towards basic services. Now, you don't have to get, the resources are limited everywhere, but it's the use of existing resources that we want to get more bang for our buck. And the way we'll get more bang for our buck is to channel them towards basic cost-effective interventions. There have been many hospitals built in this country in the last few years, but oral rehydration solution, which is very, very cost-effective until recently, has not been widely available, and now we're trying to make it available. So even without significant additional resources, you can be able to allocate and use what you have more efficiently. That's one. But secondly, with the partnership that we're pulling together, with what we've heard from the US government, we do know that we will get additional resources. I don't want to give you a figure like happens most of the time. People make pledges and it doesn't materialize. I don't want to misguide you in that. But we are confident that the path that we're taking and the way we're going to measure the results will show that, in fact, Nigeria is making progress in those areas. You mentioned Begega, and I also mentioned it in my speech. This is a place in Zamfara which is right in the middle of an area where there's been an unfortunate lead poisoning. which happened 2 years ago, and hundreds of children were afflicted. And it's in an area, Bagega is only one town, there are several towns around it, and I visited the place primarily to assess the situation with lead poisoning, but also to look at what we are doing in primary healthcare, and was impressed to see the midwives serving in a very remote part of the country, and they're very comfortable doing what they are doing there. Remediation is to do with the environment. The lead poisoning issue is a nexus between mining, environment, and health. And so when people do illegal mining and bring their mined products home and process it, inadvertently they poison their environment with lead, which then ends up in their children. The remediation effort is an environmental remediation, which entails taking soil out and replacing it with soil that is not contaminated. As at when I visited Bagega, the remediation was already ongoing, and the State Ministry of Environment is fully involved, and the federal government was also supporting the state in that way. We focused from the health sector in terms of understanding, surveillance, but also recently bought 2,000 boxes of Soxima, which is a chelating agent, which will be supplied to Bagega. But even before federal government intervened, other partners, the state government itself, have responded in their own way. We know that partners like MSF, USCDC had also contributed. So it's a collective effort to deal with the remediation, to take care of those who are afflicted, but in the long run is to prevent these illegal mining practices and the contamination from happening. You can't go chasing wherever there's lead poisoning after the fact. There's more important preventive effect to that. And that's what a task force that the federal government had set under the leadership of the Minister of Mines, with the Minister of Health and others, actually is working in that. It's not only in Zamfara. I think there are other areas that there may be illegal mines, they're hiding and doing their own thing. Unfortunately, the byproduct of that might afflict people's health, and we constantly are trying to increase awareness among people to be mindful of the environment and the work and the chemicals that can be introduced into the environment that can afflict people's health negatively. But we cannot be all places at all times. So I will ask my co-panelists to just give their concluding remarks from the very extreme, and then we conclude the session.
Members of the press for being here and helping evangelize this work and why it's so important, and to educate people into the myriad of responsibilities, but also real opportunities that we've discussed today. The responsibilities of holding all of us here on stage accountable for what we've said we each would do, and the opportunities to really save at least 1 million lives by 2015, and to have that momentum carry all of us forward. Chai is very excited about our work in Nigeria and excited about continuing to build on that work with all of our partners here, and under the strong leadership of President Jonathan, whose commitment and passion were profoundly evident today, and your remarkable Minister of Health.
In the context of something else, which is in the context of peace and security, which is about the responsibility to protect. And I think R2P is responsible to protect.
want to say from the deep bottom of our hearts, big thank you. Big thank you to all of you for taking time out of your busy schedules to visit us, to hold this meeting of the UN Committee. See our President launch the ceremony, also to continue with the meeting PM that are happening in Nigeria this week. Really appreciate your commitment and your participation. There's a saying, someone said, in the colonial times, villages, they said, if a white man says to you, if he says to you, say thank you. You'll say thank you very much. And if he's truly happy with thank you, and thank you again. So I think thank you, and thank you again. In one way or the other. I know the messages of the Commission is a homework that I cannot say. Thank you for all of what you've done. Exemplary work over time. Sometimes I'm amazed. I see the meeting of minds, practice, the need, follow up. But I know they've done a fantastic job. I wish not have the report, not have the plan, don't even have the platform to actually the Secretary of the Commission.